Hello, I'm John Urbans, President and CEO of Greater Fort Wayne, Inc. Welcome to the Roadmap to a Healthy Reopening webinar series. Today, we will be focusing on Parkview Health's human resource response to COVID-19. As our community's largest employer, Parkview has not only been on the front line of the healthcare battle, but they've also had to modify their human resource practices. I want to thank our partners today, Parkview Health, Greater Fort Wayne, Inc., the Northeast Indiana Regional Partnership, and the Allen County Department of Health. Just for housekeeping, please hold your questions until the end or the second half of this webinar. We will have a question and answer segment. We received a number of questions up front that we'll be covering, but then we will also be using the question and answer tab at the bottom of your screen that you can submit a question. Following the webinar, you will be receiving an email that contains a survey. You will receive a second email with a link to the recording and a copy of the slides of today's webinar. There will be a slide at the end with the SHRM PDC code for those wanting continuing education credits. I'd like to thank the participants for submitting questions in advance. They shape as a guide for the Parkview team to develop the content for this webinar. Several weeks ago, Governor Eric Holcomb rolled out the Back on Track Indiana plan, a 5-stage plan for reopening. All of Northeast Indiana is currently in stage 3 with hopes of moving to stage 4 this weekend. The plan is driven by 4 guiding principles. Looking at the number of hospital COVID-19 patients, making sure the state retains the capacity or surge capacity for critical care beds and ventilators, that the state retains the ability to test all Hoosiers who are COVID-19 symptomatic, healthcare workers, essential workers, and first responders, and then make sure that contact tracing abilities are in place for those testing positive to COVID-19. This webinar is part of a series of webinars that have been completed. The recordings for industry-specific webinars are available online at webinar.gfwinc.com. Please feel free to go there and view the slides or the recordings for any of those previously recorded webinars. At this time, I'd like to turn it over to Dina Jackway, Chief Community and Human Resources Officer for Parkview Health.
Great, thank you, John, very much, and appreciate this opportunity to share with the HR community a lot of what Parkview has seen over the last several months. We know, and we've experienced it as well, it's been feeling like we're flying a plane and trying to fix it at the same time. It's caused a lot of disruption as a community, as an organization, but we also know that there are things that run deeper than this moment in time. And we know that in our field of human resources, this is a great time for us to shine and really show our focus on people and why people are the most important resource within an organization. So I'll start with just getting back to business and where we are as an organization, and then we'll dive in deeper, and you'll hear from a number of our human resource experts that are here as part of the Parkview team. When we think about the virus today, we know that we're in the stage which is community spread. We know that it's not limited to one place, one area. We know that the source can no longer be pinpointed. But we also know that we're 12 to potentially 18 months away from a vaccine. And why that's important is that the social distancing that we have seen over the last several months won't go away on July 4th. If the governor continues on with our Back on Track plan. Those things don't go away automatically because we still need to keep our community and our coworkers very safe. And the goal for us as a healthcare provider is to be able to keep not only our patients safe, but provide our community the best resources possible to keep us all safe. So as an organization, Parkview is here, we're ready to serve, and we have continued to serve our community throughout this, but know that we're watching very carefully. And I would say that you can see our impact meter here. You know, we're not in times of crisis, but we are definitely in times of caution. We're starting our services gradually. For many months there, we're in a period of time where much of our services, elective procedures were all restricted, and now we're beginning to open that up. but our visitor restrictions still remain into effect. And why is because we're, as you know, the CDC guidance is changing and so much is coming in. We want to continue to keep people safe. That is priority number one for us. So as we think about these last few months, and this is why we're doing this webinar today and why we've done so many of them with so many of our businesses in Northeast Indiana and industries, is because Parkview is more than a trusted healthcare provider. We have a police force. We have 10 cafes across all of our facilities. We have an innovation center. We have an event center. We have a supply and distribution center. So many of the things that we do within our business, we're doing out in the community. And you all have businesses that are similar and the kinds of services that you provide. And so we felt like we experienced so much that we want to share what we've learned. And we're not saying that what we're going to give you today is exactly what you should do. I mean, I think you're all on a journey of what best fits your organization, but we feel like we've learned from others, not just within our organization, but other healthcare providers, other organizations in other industries, and we're sharing with you those best practices as part of our Business Connect platform. And we have a website. We'll share all of that with you as we get further into the presentation, but it's a living site that provides workplace considerations and people considerations and a lot of best practices and documents, not only from the national platform, but also those things that we have seen locally and regionally that have gone really well. So it's our way to really give back to the community. When we think about the business of human resources, I have a personal philosophy around HR, and that is the business of HR needs to be driven by the business, not by HR. And it's something that we know that as our organizations change, we are on the front lines of being able to help the organization change. We are the shepherds of the culture in an organization. And so a couple of words I wanted to share with you that kind of tee up today. I mean, people, it's at the heart of what we do. It is the most valuable thing we have in an organization. It's about talent. It's about attracting talent and retaining your talent and developing your talent. But it's also caused us over the last few months to be extremely flexible. Frankly, more flexible than we ever thought that we might even be. I mean, a great example is we have been saying for many years, we're not going to have our hourly coworkers working from home. Well, I will tell you that in about a matter of a week, we had 4,500 of our 13,000 coworkers working from home. We did it fast. And we look back and think, well, why weren't we doing that all along? So we've been a little vulnerable too in realizing the things that maybe along the line that we've always said, we're going to continue to do that. Well, we don't need to continue to do that. It's not best practice. And for us, frankly, it's really all about giving our coworkers a frictionless experience. This is not just COVID and what they've gone through in the last few months. This is the business of HR and making sure that any coworker in an organization can experience what they need to from an HR standpoint in a frictionless way. And so we challenged our team to really look at what ways, even now during COVID, can we do it to make it simpler for our coworkers. And I definitely think this last bullet is so important, and that is the voice of our coworkers are so important. And we want to be able to relay to you how the voice of our coworkers shaped the way that we have reacted and responded to COVID. So today's goals, really, there's just a few I want to highlight. One is, this is not, again, one size fits all. This is not that we expect that you walk away and you do this exactly the way that we did it, but we really want you to be able to tweak it, what fits your organization and fits your culture. And we wanted to be able to share, again, the things that have worked for us and frankly, the things that didn't, and lessons learned along the way. But we have a lot of creative team members and a lot of innovation that went into doing some things differently. Not only, again, that flexibility that we afforded our coworkers during this time, but how our coworkers, we expected them to be flexible. And then finally, just perspective. I think that we, stepping back several months later and looking at the variety of perspectives that this has given us, especially when it comes to whatever this, and I know the word new normal is being used all the time, but whatever that normal becomes, what that perspective is perhaps has now changed in terms of what our roles are and what HR really means in an organization. So before I turn it over to Hallie, just again sharing with you the Parkview Business Connect. We have a variety of ways that you can connect with us. There's a website, there's a phone number. We're getting back with businesses within 1 business day. We've shared this in all of our other webinars, so many of your organizations may have already connected with us on a variety of questions. We want you to be able to do the same, reaching out to us in a variety of ways, and happy to help you with individual questions or individual experiences that you have and you would like to have that elbow-to-elbow support. So now I'd like to turn it over to Hallie Custer, who's our Corporate HR Director.
Good afternoon. I'm Hallie Custer. I'm Corporate Director for Parkview Human Resources. And again, we wanted to come together today to share some of our experiences during this time with our community business partners. We know that this is an extremely stressful time for you. It's been very stressful for us as well over the last several months. And we are all still living it. And as Dina said, we will likely be living through this for another 12 to 18 months until a vaccine is found, which kind of makes me want to cry every time I hear that. So we're hoping that today we can provide you with some information that will really help you operate during this time. Some of the things that we're going to share, they might work for you, they might not work for you, you might have already implemented, but again, we're here to share our experiences in hopes of perhaps you can gain some insight. And if you can take away even one thing that you can implement, then we feel that today's webinar has been a success. So as you can see, we're going to talk about some key topics and initiatives that we have implemented. And these were areas that really became our priority when all of this started. And really what we're sharing is these are the things that we're still doing and we are going to continue to do until the foreseeable future. But we found that these are the areas where we really needed to be flexible and creative. And we needed to do it quickly, as Dina also stated. And I'm not sure if you felt the same way. Things happened so quickly when this all started and everything seemed to change. Everything changed every hour, it seemed. Today, we're going to focus on the people and the HR operations side of the business. And as you know, we do have Business Connect. So if you have other questions, we really encourage you to reach out and we will get you to the right subject matter expert. So I'm going to now hand this over to Bruce Buttermore, who will speak about our interviewing, hiring, and onboarding processes.
Thank you, Hallie. As Hallie stated, my name is Bruce Buttermore. I am the Director of Talent Development here at Parkview Health. And today I'm going to spend some time with you and talk to you first about our interviewing and hiring process. First, I'd like to start by saying we recognize that several of you on this call may not be in a state to actually interview or hire or even hiring individuals at this time. But because of our continued clinical needs, we have got to continue with our interviewing and hiring process. So we want to share with you some of those best practices that we have come up with and think that hopefully these will be some takeaways that you can learn from today. So when it comes to interviewing, because we could not have candidates coming into our facilities for interviews, we set up virtual interview processes, whether that was done via phone call or video conferencing. But we wanted to have that ability to interview these candidates from a virtual standpoint. Another process that we do as part of our normal interview process is we have what we call a job shadowing, or giving that candidate an ability to see the environment in which they'll be working in. And so because, again, we couldn't have these individuals coming into our facilities, we had our departments do videos tours where it gave these candidates the opportunity to see the environment and the workspace in which they would be working in. And finally, when it comes to actually hiring these individuals, we also wanted to do that, or we had to do that in a remote setting. So we had our talent acquisition team do one-on-one pre-hire sessions where we were meeting with these candidates remotely, one-on-one, to give them that individual attention to make sure that we had all the documentation and paperwork that we needed in order for them to start with the organization. And next, we also wanted to review and consolidate some of our processes. We recognized we wanted to keep this as seamless and as frictionless as possible. So one of the things that we did is, for example, our pre-hire drug screen and physical. Prior to COVID, a lot of our new hires would go for a drug screen and then may have to come back for the physical at a later date. So we combined those appointments to make it less frictionless and a much more seamless approach for these new hires. The second thing we did is, because we weren't able to have that face-to-face interaction with these new hires, we had a very close connection and staying connected with these hires to make sure that they understood where they were in the process all along their journey, from the interviewing all the way up until the point we were ready to actually hire these individuals. And so we used an avenue of resources in order to do that, whether it was the individual wanted direct phone calls, did they prefer text messaging, did they prefer emails? So really finding out what was that best method for that individual candidate, and then communicating with them in that fashion. So once we hired them, the next step, of course, is we had to onboard them. And when we look at our onboarding process, previously we would bring in large groups of individuals into a room for guest speakers to come in and speak with these new hires. But because we could no longer have individuals in the same space or in close proximity, initially we started with a video of our new hire orientation and utilized our e-learning system as a platform for them to gain that information upon hire. But then we stepped back and said, you know, we really want to have a more interactive process and a better experience for that new hire on their first day. So actually, as of yesterday, we kicked off a live stream new hire orientation so that all new hires that started yesterday with us did it through a live stream format. So they're actually able to observe and see these new, the speakers from a virtual live standpoint, as well it gave them the opportunity to interact via chat method or even from a verbal standpoint as well. So we had great outcomes from that and great feedback from that as well. But we also have areas that do still require that we bring them in for in-person training. And so for those types of trainings, what we did was we really looked at, one, limiting that class size to less than 10 people, including the trainer, as well as making sure that the rooms were set up appropriately in a fashion that would allow folks to do social distancing, as well as providing them with hand sanitizers and tissues, again, for the safety of them as well as other participants. Another thing that we continue to enhance is our e-learning and video formats, especially when you think about personal protective equipment. That became top of mind for a lot of our coworkers, and so we provided video formats and a lot of e-learning around reminders on how to properly use personal protective equipment. And so we did that through a virtual format as well. Another resource that we provided is through our organizational development team. They produced several webinars and podcasts to support not just the coworkers, but also the leaders, to help those individuals who are working remotely and how to stay connected with them, tips and tricks on how to join live stream meetings. So really looking at that support that they needed during this time of crisis and pandemic that we're living in. And finally, we increased our online resources. So having up-to-date articles and information readily available for our leaders and our coworkers to access it at any time. And finally, something again, as we look at your organization, we all come from different organizations with various needs. And so in your organization, are there positions that may not currently exist today that you may need to look and consider in support of COVID? And so one of the first things we did as an organization, we stepped back and we identified probably 6 to 8 roles within our organization that we needed to have in order to support COVID-19 and to support our coworkers in a different capacity. And so as Dina shared earlier, we had several of our physician offices and our elective surgeries were canceled at the height of the pandemic. And so because of that, we had excess coworkers available for deployment to reutilize within the organization. So once we identified those new roles, we were very precise in determining what the specific skill set and what those roles consisted of. And then we created online curriculum to have those coworkers prepared and ready to go in the event that we needed to redeploy them to other areas within the organization. And then, of course, being healthcare, nursing was another big focus for us, in that we had several nurses who have worked in the physician offices that may have practiced as a bedside nurse several years ago, but may not have had that experience. So we created an express orientation to get them prepared and ready to go in the event that they would be needed within the facilities or within the departments and where we needed that extra support for COVID-19. So again, we hope that you take this as an opportunity to see how this can fit within your organization, and hopefully have some takeaways as well. Up next, we have Becky Gonzalez. She is our HR director.
Good afternoon. So this afternoon, I'd like to talk about policies and coworker support. So this has been a time for our coworkers that not only is it the unknown, they see a lot of things on the news, hear a lot of things. That central source of truth is extremely important for our coworkers, and that's us in the HR department. We are the resource for our coworkers, and supporting them during this time is extremely important. So when we looked at our policies within the first few days of the hit of COVID, we looked at our attendance policy. And we thought, you know, in looking at the CDC guidelines and the recommendations of relaxing attendance policies, we made the decision that we definitely would relax our attendance policy. Most importantly, so individuals did not come to work sick. We relaxed it to the point where we weren't issuing corrective actions. We were ensuring that people felt as if they could stay home and not feel as if their role was jeopardized. It was new for individuals out there in the community, their children. They didn't know, you know, is my kid going to go to school? Is school canceled? What's going to happen? So in relaxing those policies, at this point, we still have kept those policies relaxed around attendance, simply because, you know, the unknown is still out there. Individuals still have children they need to care for, and those types of things. So for the leave of absences, many of you are covered under the FMLA. But one of the things that we had in addition to the FMLA was a leave of absence policy, and it was only allowed though for coworkers who did not meet FMLA criteria for their own personal illness. We relaxed that as well, opened it up to individuals to be able to use for their family members or illness outside of their own. Disability pay. So we all have waiting periods. Most of us who are, if you have a third party as your disability pay organization that you work with, many of you will have a waiting period. So we looked at our waiting period and we made the decision that pay could be established during that waiting period as well before an individual met the disability criteria while they were out on their own personal medical leave. And PTO, in the past, or vacation time for those of you who have vacation policies, we relaxed that as well and allowed individuals to use PTO hours before they actually earned the hours. Again, so they would be paid, they would not have to worry about the financial portion, and most of all, when individuals feel like they were going to be paid and taken care of by their employer, they are not going to come to work sick, and they're going to keep our organization safer. Communication was huge for us, and when you think you've communicated enough, communicate 10 times more. So it's been very important as we have ensured and opened the channels up of communication. We created a designated COVID-19 web page on our internal intranet. In addition, we created FAQs with that central source of truth and continuously updated it and updated those FAQs as things changed. As you know, many things changed quite often for all of us. So we continue to keep those FAQs updated. It's all about me. You know, as a coworker myself, it's all about me. I want to understand, what's going to happen to my employment. I want to understand what can I do, what can't I do. These are very important things for individuals, and allowing them to feel safe and allowing them to feel supported by their employer. How we make and how our coworkers walk away feeling about Parkview and how they were treated, or feeling about your organization and how they were treated and what you were able to do for them during this time is extremely important. They'll remember that forever. I encourage you all, if you don't have a centralized email box, or if you have several leaders within your organization receiving various emails from employees, that you would incorporate a centralized email box for that filtering of all questions that are related to COVID. And whether you meet as a team to come up with answers and responses back to your employees, it just allows for the central source of truth again to convey the same message across your organization. We found that to be very helpful, and it also allowed employees to reach out to us, and then we could answer them not only one-on-one, but as we saw repeat questions, we were able to incorporate that with our FAQs. And once somebody has a question, usually others have the same types of questions. So, and publish those updates in the FAQs. Then we also put together leader webinars. As a leader in your organization, we've received lots of communications from many different sources externally, and we're right in the middle of all of this change. And I don't know about you, but myself, I would get confused on what's happened now, where are we at? What we were this way last week, how are we this week? So creating a leader webinar or a education for your managers and your supervisors so they understand things and have the correct answers and the correct information, we found to be very beneficial as well. So COVID not only has a physical impact on our coworkers if they are sick, but it also has had a mental, financial, and overall well-being impact. We recognize that, and one of our with people as our main focus, one of our responsibilities is to ensure that we can provide various resources to our employees so that they are mentally, financially, and overall supported, whether they're working in the office or working at home. So the Calm app, we have found that to be extremely beneficial for our employees. We've had several thousand individuals out of our 13,000 actually load the app and register utilizing the service from the Calm app. Employee assistance program. Many of you probably have an employee assistance program. Now is the time to communicate, and utilize that resource. Our mental health and well-being of our coworkers is greatly impacted. We compare this to, this is our war, our PTSD, our war, what we have to provide to our coworkers so they are mentally taken care of. So the employee assistance program, again, if you have one, now is the time to really communicate it if you haven't done so in the past. We also put together what we call a daily dose. So this is a short 4 to 5 minute video every single day that comes out. And, for several weeks, folks were not able to go to church. They weren't able to get that message that, unless they are part of a larger church, they weren't able to necessarily get that message and feel that same connectivity. So we put together a daily dose that not only has mental support, but spiritual support as well. Group exercises via Zoom, the way to connect. It was a way for our employees to connect with each other and improve not only their physical health, but their mental health, and stay in touch with other counterparts and coworkers. Tap into your employees within your own organization. There are a lot of great resources within your own 4 walls that would probably love to do things like this for their coworkers and for their counterparts. And just tapping into them and letting them be creative could also allow for Zoom programs amongst your own organization. We provided financial webinars and opportunities to participate in those types of things. Individuals have had spouses who are laid off or have been impacted one way or another by COVID. And then the Emergency Assistance Fund. We have an emergency assistance fund for our employees here at Parkview. and we actually loosened up what the criteria was in order to be able to utilize this fund. Organizations I have seen that haven't had one of these funds set up in the past have looked at, maybe this year they're not going to have a picnic, or they're not going to have certain events that they've sponsored, and they've taken the money from those types of things they were going to sponsor and put it into an emergency assistance fund for their employees to, you know, if they would qualify, take advantage of as well. So what other resources did we provide or create for our coworkers? A concierge service. We utilized folks who were not working in their current capacity or role. We put together a concierge program. This program allowed for employees who were out either quarantined or out ill due to COVID or a family member. At that point in time, we offered essential services to them, such as eggs, milk, you know, minor grocery items. We had things delivered to their home. We wanted to take care of them and meet them where they were at. They're the ones who are mostly impacted by the COVID, personally impacted. And so therefore we reached out and we were able to provide them with those simple services when someone cannot make it to the grocery store because they're quarantined. Ensuring community resources and those pieces of information are out there and available to your employees. We definitely would encourage for local food bank numbers, the local trustee, their township trustee, 211, publishing this kind of information. Employees may not necessarily come forward and say they need help, but when you have this information, whether it's published in pamphlet form or it's published out on your website, having those resources available at their fingertips, they're more likely to utilize that. Essential items market. We put together actually a little market within our own nutritional services department and our cafeterias that offered bread, milk, eggs. They could buy these items at cost. As we approach, you know, summertime and gardening, you know, you may have employees within your organization that are, you know, avid gardeners. Perhaps they would want to bring in those items and allow for their coworkers to purchase those items as well. And the essential market, even when we had toilet paper shortages, was very important to our employees because they were able to get the things that they needed. Hoteling. We partnered with local hotels here in our area, and if an individual was exposed to COVID or quarantined, we had discounted rates for them. Our community was very eager to work with us and connect to our employees and allow for those discounted rates as well. So they weren't going home and feeling as if they were exposing their family members. And then community meals. If you have local organizations or individuals reaching out to you wanting to donate, whether it's meals or supplies or various items, creating a central funnel really for what's the intake of that information so it doesn't become lost amongst many. It's that central point of information. So while this is my last slide, this was actually the very first topic that we as an HR team tackled, and it is elder and child care. So, you know, while my daughter is 19, I certainly remember the times when she was young and at home, and knowing that my daughter is taken care of makes me feel taken care of, and I have more trust in my employer. So while some of these items have a cost to them, we created a Facebook account, a private Facebook account. Coworkers could enter their employee ID number and be allowed into this Facebook group. And then they could post their needs as well as their desires to provide childcare for other coworkers. We reached out to our local universities and engaged our local nursing students, focusing on a safe set of resources to provide to our employees. They were also provided with a code, and they were able to enter that code and offer their services as well. But this allowed at no cost for our coworkers to utilize each other and reach out and make those connections. Care.com, this is a nationwide organization. While there is a cost attached to it, this may be an avenue that you would, if you would want to talk more about, I'd be really happy to talk about that and what they had offered for us and what we've been able to offer for our coworkers around childcare and elder care resources. Partnering with the local YMCA or other childcare organizations, and again, connecting your coworkers and providing that information to them on how and what services are out there and available for them to use. And then lastly, we had worked really hard in creating a plan in the event we needed to open our own internal daycare. And while we did not flip the switch and actually have a go live with that, we put a lot of work into that and really checked out what we needed to do, how we would have this all work and run. And an internal daycare may be something that in the future you may need to consider. So this time I'd like to roll this over to Rhiannon Kruckerberg, our Manager for Human Resources.
Thank you, Becky. Good afternoon, everybody. First topic we're going to talk about this afternoon is our telework and remote coworkers. As Dina had stated previously, in response to the governor's stay-at-home order, we shifted nearly a third of our workforce from working within a Parkview facility to working at home. And we did this relatively quickly. As she said, it was within a week that we moved these individuals from one of our sites to work from home. And prior to COVID-19, working from home was somewhat of a rarity. And considering an hourly coworker to work from home wasn't something we had ever thought of. But since this shift to work from home due to the stay-at-home order, we've realized that we can successfully have all types of coworkers working from home. However, it also made us realize that we don't have a lot of guidance and resources in place for these remote coworkers. So what we've done is we have developed a policy that we can actually utilize for longer term settings than just COVID-19. The policy does outline what our leader and coworker responsibilities look like. It outlines what our IT, safety, and security requirements are. And it also outlines that not every telework agreement is going to set a precedence for the next. Meaning, you know, we do work in an organization where there are some roles that just cannot work from home. We work in healthcare, so we do need people here to care for our patients. In addition to the policy, we've also created a telework agreement and safety checklist form. Here at Parkview, we have made these forms electronic, and they essentially serve as an attestation that the coworker and leader are in agreement that the coworker can work remotely. It'll outline the schedule if the coworker isn't working from home full-time, if they're going to work from home 1 or 2 days a week. If there's a role that requires that they be available certain hours of the day, it will outline those items as well. And then the safety checklist outlines just some basic safety things that the coworker needs to keep in mind while working from home. Parkview as an employer is still responsible for ensuring that our coworkers are working safe from their home facility, and it just gives them some tools and some things to consider when working from home. One of the biggest things is making sure that their workspace is set up and is ergonomically safe for them to work from home. We've also put together a leader toolkit that just has some tips and tricks to effectively manage remote workers and how to keep them engaged. It gives things as such as how to make sure that coworkers understand what their responsibilities are from working from home and what their expectations are, and ensuring that they have the right IS tools to communicate effectively with those coworkers who are working from home. It also gives some other tips to keep people engaged while working from home. One thing that we have to keep in mind is that some of these coworkers that we have sent to work remotely are used to working in cubicle spaces with several other employees. So keeping in mind that they may be struggling from your loneliness of working from home, and how can we make sure that we keep everybody together as a team, even though we are still separate. It also helps us to realize that we really need to measure performance based on outcomes versus the time that the coworker is sitting at their computer, making sure that they are meeting those expectations by giving those outcomes. Parkview also recently launched a telework survey to those coworkers who have been working remotely. It is a great tool to utilize to try to understand what our remote workforce needs. How are they feeling working from home? Are there other things that we can do to support them from working from home? Do they understand what those expectations are? Do they have everything they need to be able to do their job from home? Do they feel like communication with their team has been successful? Once we gather that feedback, we're able to track and trend some things that are happening with our remote coworkers, and we can make adjustments to our remote workforce. Another item that we've created in light of all of this is a dedicated resources intranet page for our leaders and coworkers. When we first moved to have everyone work from home, different departments were working to pull together different resources. Our IS team has put together some resources that's on their site. So what we did was we reached out to all those different areas and said, hey, what resources do you have available to our remote workers? Can we link everything to one site so that way people aren't digging through our intranet page to try to find everything that they do need to be successful while working from home? The next thing that Parkview did, and this is actually something, the COVID hotline was something that was created about a month into the COVID pandemic really hitting Parkview. And it was created in light of the fact that we really have a lot on our leaders as far as communicating the changes to our coworkers, and being a workforce of 13,000, that's quite a bit for our leaders to keep up with. So it was determined about a month into this that it's difficult to stay up to date with all the ever-changing environment and policy changes. So we did implement what we have called our COVID-19 hotline. Here at Parkview, we did staff this hotline 7 days a week, and it was staffed by Parkview nurses. Some of your organizations may not have nurses available. It wasn't something that was required. It was just a choice that we made here at Parkview. The hotline staff did have algorithms and information available to them, so they were providing a consistent message to anybody who called the hotline. Coworkers were instructed to call the hotline if they had questions or concerns regarding COVID, or if they were experiencing absences due to COVID, whether for themselves or to care for a family member. And the hotline staff would ask a series of questions to best understand what was going on with that coworker and give them advice on next steps, whether that is you are safe to return to work, so you may return to work, or you may need a leave of absence and this is how long we expect you to be off. Please call us back and we'll be able to tell you if it'll then be safe for you to return to work. This was the flyer that we've created to help advertise our hotline internally. It also gave some return to work guidance. So the COVID hotline would manage our leave of absence and return to work process, just so we could ensure that everyone was getting the same message across the board. And my last topic today is accommodations and what Parkview did with this topic. So obviously COVID has created a lot of fear across Parkview, across the world, frankly, and a lot of coworkers who are working remote or have been off of work due to services being temporarily paused may have some apprehension, may have some fear regarding coming back to the facilities. And we as leaders, first and foremost, need to pause and really seek to understand what's going on with these coworkers and their fear. We may be able to reassure them that we are taking the proper safety measures to keep them safe, but we also have to keep in mind that that fear may legitimately stem from an underlying medical condition that has them fearful that they are high risk of contracting the virus. So making sure that we take that into consideration before we just brush off their fear. So what we at Parkview have done out of this fear and out of these conversations is we have created accommodation forms specifically related to COVID. Although Parkview has had a process in place for quite some time regarding accommodations, it felt like we really needed to kind of hone in on these COVID related accommodations because we were getting so many of them. So these forms, we do have a more broad COVID-19 request for accommodation form, as well as a face mask request for accommodation form that we created. These were made available for coworkers to take to their providers to have them complete that. So it just validated the fact that they did need an accommodation. Once we went through our normal process, which included a validation through our occupational health team, we would sit down with the leader and the coworker and determine how can we best accommodate these coworkers with these requests for accommodations. Sometimes it meant reassigning them to another area to prevent them from being exposed to COVID. Sometimes that meant allowing them to be off on a leave of absence until it was safe for them to return to their role. And this is something we'll have to continue to manage because, as we all know, COVID is not going away. I think now we're going to head into our Q&A session.
Thank you for all that great information from the Parkview team. We are going to go into the Q&A session right now. We have a number of questions that we already have slides for that were submitted. So we're going to start with those, but the Q&A tab is open. I will let you know that most of our webinars that we've done previously were an hour long. We did have 90 minutes for this one, so hopefully people have time to stick around for the Q&A. If you don't, all the questions that were submitted early, there are slides, so that will be on the slide deck that you do receive when you get the email following the webinar. So let's go ahead and jump right into the first set of questions. How do you think COVID-19 will affect retaining and recruiting coworkers?
Hi, this is Hallie. I will answer that question. Basically, again, as we described, we really want to ensure our coworkers and our candidates are aware of all of the things that we're doing from a safety perspective. And it's really about emotional well-being, as we discussed. So we really want to be able to provide just that ongoing support for their well-being and being able to explain that up front to applicants and also to our current staff who might have some reservations, some fears, going through a difficult time. Again, we just want to be there for our coworkers and really hear them and listen and see how we can help. And we've really feel like some of the things we've implemented, we've feel like we've been able to support our coworkers through this difficult time.
So somebody submitted the question, we have coworkers who don't want to return to work due to the pandemic, but we need many of them on site. How do we encourage them to return?
So coworkers, it's all about engaging in dialogue and having conversation with your coworkers and understanding what are their concerns, what are their fears. One of the things that we are in process of putting together right now and we'll be sharing and would love to share with others is preparing folks to come back to work. What have we done while you were out? What's happened while you were out? What are we doing now? And then on your first day back in, what doors do you enter? Where do you pick up your face masks? How do you clean the conference room? How do I keep myself safe? So we're putting together guides and looking at putting together a computer-based learning prior to folks coming back their first day. So they're prepared and understand what has taken place and what the expectations are going forward rather than walking in blindly.
How do you track accommodations while navigating the lines between ADA requirements and COVID-19?
This is Rhiannon. So what Parkview does is HR does maintain a spreadsheet of validated coworker restrictions. So as I had previously explained, we do have a process in place where we have the coworker take a note from their provider to our occupational health, and they just validate that restriction. The spreadsheet does list out what the type of restriction is, whether it's a lifting or it's in hours of work. It also explains what the duration of the restriction is and how we accommodated the restriction.
How should we be monitoring and tracking coworkers' health?
So first of all, we don't want anyone to come to work sick. Again, reiterating with employees, do not come to work sick, do not come to work sick, do not come to work sick. And we've also have a guide that they are able to, or a tracking form, a screening form for their own selves that they are able to utilize prior to coming to work. We don't require that, but that is an option that some employers are putting in place, is self-monitoring and even temp checks in some locations. Although we aren't, it may be something that you're doing at your organization. So.
One of the big questions through this process has been, what process do we take if someone becomes ill at work or after they've recently worked? How do we handle that return to work scenario?
So as Becky just explained, we never want to see a coworker reporting to work ill. Pre-COVID, it was something that Parkview leaders had the discretion to do, is to send coworkers home who were exhibiting any type of symptoms, just for their safety, for our patients' safety, and for other coworkers' safety. But since COVID, we have followed the CDC recommendations to have our healthcare workers remain off of work for at least 10 days since the onset of symptoms and at least 72 hours since a fever has passed, if they are exhibiting those COVID-like symptoms. And we were utilizing our COVID-19 hotline to make that determination.
How should we be paying our coworkers who are off work due to COVID-19?
Again, this might be very different from organization to organization. Each company has the ability to handle their policies and their pay practices. We definitely did our best to keep our coworkers whole during this time. But again, I think each company needs to decide how they want to handle. It's very different when you have a covered leave of absence where their job is protected, but then the pay piece is really dependent on how the company wants to handle that.
Communication has obviously been very important through this pandemic and time off. What are some of the ways we can communicate our precaution measures to both our coworkers and our customers?
Okay, so I touched a little bit on this before, and whether your channels are via email and attached PDFs, or your channels are a computer-based learning process, whatever works best within your organization, point of contact signage is very important as well. So if I read something and it's a week before I'm in the conference room, not expecting your coworkers to remember what they read a week ago, but having at that point how to clean, how to properly social distance, having those reminders and those visual cues is also very important for ensuring the safety of our guests and our coworkers.
We're going to jump to one of our live questions real quick. And you talked about new hires and doing some live online learning. How do you take into consideration different learning styles of new hires? If the person doesn't learn well with the online training, do you arrange for in-person training?
Yes, this is Bruce Buttermore. In regards to learning styles and how do we adapt to that, it is offering variety of avenues, whether it's online training for those that it's easy for them to learn via internet or online training, or we do have some one-offs where we have individuals who that's just not their best method for how they learn, and so we will do some at the elbow training for those individuals who need that one-on-one support. And it's also a partnership with our departments. If it's something more specific to that department, it is, having that department leader partner with us from a development standpoint to work with that new hire to ensure that they get the training and the development that they need.
This is a good question. Can we mandate coworkers to return to on-site work?
I think in short, the answer is yes. However, there's some considerations to take in, and that is, do we need these coworkers to return to work? Is it necessary to have them report to work in order to perform their role? And if there is hesitation to return to work, asking our coworkers why. Why are you hesitant? What is the apprehension behind it? And trying to, again, understand that fear behind it. I know we here at Parkview have chosen to allow coworkers to remain at home regardless of the opening back up plan, and that's something that all employers should consider doing if they are able to do so.
How can we best engage our coworkers to be part of managing our precaution measures?
So again, this goes back to communication and continually, I think, walking the talk as leaders. It's really important. So ensuring that we're practicing the safe social distancing, wearing our masks when we're, in groups of individuals. It's really important that leaders walk the talk and that we continually communicate, as well as ask our coworkers, what do you need? What are we not hitting that you need to see to help you better manage your health and entering back into the workplace?
I know here at Greater Fort Wayne, as we developed our protocols for return to work, we asked for input from all the staff and had them sign off on what the protocols were. So just a thought, make sure and encourage people to participate in those types of processes. And one of the good questions is what really works to keep coworkers safe?
So this is Dina. I think the graphic that's on the slide is a really great depiction of what we call the hierarchy of controls in a pandemic right now, although this could apply in other disaster or other situations. But for us, you start at the top and those are really the most effective things you can do. And we start with elimination, just simply remove yourself from the hazard. So the fact that we have so many of our coworkers who are working from home, well, we've eliminated them from the environment that potentially they could be exposed. And so that's really that most effective way. And as you go down the hierarchy of controls, you can isolate people from the hazard. And you have engineering controls such as setting up hand hygiene stations, being able to social distance, provide masks. I heard our team talk about masks earlier, and we provided 3 masks to each coworker so that it was available for them as they were engaging within the hospital or engaging in other common areas. So you have these engineering controls to help you. And then you have administrative controls where you're actually changing the way people work. You're designing the work differently so that you're not only able to keep them safe, but you're able to keep those that they're coming into contact safe. And then finally, frankly, the least effective, and we like to call this, it's more than a mask. There are so many other things that you could do. The last resort is that PPE, that personal protective equipment, that mask. And again, it's going to depend on the kind of mask. If it's a cloth mask, then we know that what that is good for is keeping people protected against you versus the things that you might breathe through that mask that you're coming into contact with. So we like to say it's way more than a mask. And as you can see with the hierarchy of controls, there's so many other things that you can put into place to really keep people safe, starting with if they don't need to come back to work right now and they can continue working from home, then certainly do that.
There's been a lot of conversation around taking of temperatures. Should we be taking temperatures of everyone entering the building, whether it be staff, visitors, customers?
Yes, so this is Dina again, and I'm going to put my Dr. Nip hat on. I'm not a doctor, but I play one on TV today, apparently. There's a lot of conversation around taking temperatures. And this, yes, you hear it may fulfill a requirement. So there may be some kind of industry requirement or there may be a governmental requirement. But beyond that, it just frankly has not been, the juice is not worth the squeeze on this one. There are plenty of individuals who they perhaps are positive for COVID, but they don't have a fever. Or perhaps, as a coworker is coming into work and they're going to go through a temperature screening, well, they took ibuprofen an hour ago, and so then their fever's down. And so they're going to be able to get then into the building and unfortunately expose other people. Then you have to even think about the fact that you have to have screeners, which the more screeners you have, the more people you're putting into potentially harm's way because those individuals are going to be exposed all day long to all kinds of people. And then really it's this protected health information. What are you going to do with the information once you have it? And you have to make sure that whether it's the CEO or another coworker, whoever has a temperature, you have to address them the same way. So it's just really not recommended as part of that COVID-19, and it's not proved to be a best practice. Frankly, there was a live question we saw a moment ago. there are other symptoms that are coming out, and it's not just a cough and a fever anymore. There are other symptoms that we're starting to see. And so by doing just temperature checks, it's certainly not going to prove as fruitful, I think, as others might think.
I'll just remind everybody that the Q&A tab down at the bottom of your screen is active. There are some questions being answered live and in direct response to your typed in answers, and then we'll be asking some of them. I'll go to one of those next. When flexing the disability pay policy, was this only if the leave was or is related to COVID-19?
Yes, in short, that was the intent. However, we've balanced and used a lot of trust and compassion for our coworkers. We didn't ask for medical certs. This is a period of time where we didn't want to flood our physician offices, as well as, for coworkers to have to get to the doctor to have those medical certs. We've allowed for a lot more leniency during this period of time. Can I say that that's going to continue and last long term? No, we are reevaluating some of our steps and processes as we continue down this path. And we will be dividing that back out separately. So.
How long do we see the need to be taking precautions to minimize the spread of COVID-19 in our workplaces?
Unfortunately, we see this happening for about another 12 to 18 months. So I think this is our world. And I think we're all just going to get used to doing things a different way. It'll kind of feel weird not doing it over time. So I would say that this is something we're going to be living with for a while.
We'll take some more of the online questions, and that tab is open. Regarding virtual meetings, did you allow employees to restrict visual access to their home to maintain their personal privacy, or did you require them to be visible when they were available? How did you allow them to make this type of request in a private manner?
We did not restrict visual access. So we hoped that everybody would make good choices on where they were being seen and what they were wearing at the time, but we did not restrict that. We also didn't require people to be visual. I think that might have been another question. I think we kind of left it up to the coworker whether they wanted to be seen or not seen. I've seen it kind of both ways in the meetings that I've been in. Sometimes people wake up and just don't feel like being seen, and sometimes people are absolutely wanting to be seen. So we really kind of left it flexible, knowing that this is just something we all have to get used to anyway.
How do you handle an employee who is considered high risk? For example, a young adult with type 1 diabetes and continues wanting to work in an environment where social distancing will be challenging. Is there a legal liability? I've heard of an employee health plan, but can we require that?
So in this situation, what we would do is refer that coworker to go through the accommodation process that I described earlier today, which would be to have their provider fill out that form so our occupational health clinic can understand what's behind their fear of being high risk, and just to validate that there is an underlying medical condition to support that fear. Once that restriction is validated, we would sit down with the coworker and try to determine how we can best accommodate that coworker. And in some cases, under the ADA, it states if we can't reasonably accommodate the coworker, then we're unable to do that. But in our case, we were able to either reassign our individuals to a safer space for them or to allow them time off. And again, we will be evaluating this on a longer term basis since COVID's not going anywhere for a while.
Speaking of trying to accommodate employees or workers, how long do you allow vulnerable employees to be off work before you consider terminating their employment?
So the legal answer is going to be this is a case-by-case basis for sure. We definitely have not set any firm timelines. these are not situations. They are certainly case by case, FMLA eligible, ADA, and we are still navigating through some of these ourselves. But it's definitely not a decision you would want to make quickly and hastily.
Can you talk a little bit about what's the risk of coming through the ER right now? Should we as patients, what should we try to do to avoid being in contact or exposed while coming into the hospital or the emergency room?
Yeah, this is Dina. I'm going to channel my Dr. Gutwein now. I'm thinking of all of our physicians and have been working so closely with them. I'm going to start by saying we know that for a period of time, so many of our patients who really needed to come to the ER stayed away from the ER and unfortunately waited too long. And so, I mean, their conditions continued. And so we're really encouraging, if you need care, please, yes, come to the ER. And we've done some things engineering wise within our ER departments across the system to make sure that we're separating those patients that we might suspect have COVID or other symptoms that need to be separated from the others. I mean, for someone who, you know, they have a broken arm, well, we're going to have them separated from the rest of other patients that are perhaps sicker. So we've done some things on our end using, again, the hierarchy of controls to engineer our environment so we're keeping people safe. But I also think the question was good around what things can you do? So make sure that you're coming in, you know, is it appropriate for you to come to the ER? Is there a walk-in clinic option? Is it a virtual option? We've offered so many virtual visits. And so I think it's very highly dependent upon what's happening in your life that what level of service you need. But having a mask and being able to use good hand hygiene, clean hands in, clean hands out, just doing those things to help protect yourself is really important too.
Just to look at kind of benchmarking, how's your corporate offices? How have you opened those back up? Or are you staging those, bringing people back in a staged process?
Yes, so this is Dina again, and no, our corporate office coworkers are not back, and the parking lot continues. I judge success by how full the parking lot is, and if it gets too full, I'm starting to get a little antsy. We actually want to see less cars, and the reason is, and we really don't want to bring people back right now. They're able to work from home, particularly out of our corporate office. The majority of those coworkers can work from home. Some have frankly said they want to continue working from home permanently, and we want to be able to accommodate that. And others, yes, they're chomping at the bit and they want to get back, but maybe they'll come back just for a couple of days a week. But what we've said is, right now, everyone who can work from home needs to continue working from home. And when and if we bring people back, we will do it in phases, only 20 to 25% at a time, and that will actually happen over 6 to 9 months. So this is not something that we're going to wake up one morning and say, okay, everybody, come on back. It is going to be thoughtful, it is going to be organized, and it will definitely not be everyone at one time. Because when I walk around the corporate office right now, I look around and think, okay, these doors, you're having to touch these doors. Well, let's maybe look at automatic openers on some of the bathroom doors, or let's make sure that we have an environment that is set up to accommodate the needs of our coworkers. So we've got a lot to do to just get the building set up before we even start thinking about bringing people back.
I want to thank everybody for joining us today. I definitely want to thank the team of presenters from Parkview that presented to us, but also answered our questions. I want to thank our partners at Parkview Health, Greater Fort Wayne, Inc., the Northeast Indiana Regional Partnership, and Allen County Department of Health for helping us put on this webinar series. The code for continuing ed credits is on the screen here. And just a reminder that you will receive a copy of these slides in an email following the webinar. If your question was not answered today and you still have some, please visit parkviewconnect.com or call in and ask the question, and the team there will get back with you with a response. We're here to help you. If you have any questions of us, please feel free to call us here at Greater Fort Wayne, Inc., or like I said, the Parkview team at Parkview Connect. I want to thank you for joining us today, and have a good day.